An excessive level of cholesterol in the blood is the defining characteristic of the disorder known as high cholesterol, also known as hypercholesterolemia. It is a substantial risk factor for cardiovascular disorders, such as heart attacks and strokes, among other cardiovascular conditions. There are subtle signals that could suggest the presence of high cholesterol, despite the fact that high cholesterol itself most of the time does not present visible symptoms. In this video, we will delve into the complexities of high cholesterol symptoms, the significance of early recognition, and the tactics for effective management of the condition. Understanding of high cholesterol. It is essential to have a fundamental understanding of the nature of cholesterol and the function it serves inside the body before delving into the symptoms that are connected with excessive cholesterol. In addition to being an essential component in the formation of hormones and cell membranes, cholesterol is a waxy, fat-like material. On the other hand, an excessive amount of cholesterol in the blood can result in the creation of plaques in the arteries, which can impede blood flow and increase the likelihood of cardiovascular events. Common signs and symptoms. The yellowish fat deposits that are characteristic of xanthomas are often benign growths that are seen beneath the skin. They may manifest themselves in the region of the knees, tendons, elbows, and heels. It is not possible to make a conclusive diagnosis based solely on their appearance, despite the fact that they may be a visible symptom of excessive cholesterol. It is essential to have a solid understanding of the relationship between elevated cholesterol levels, inhibited fat metabolism, and immune body reactions. Arcus senilis. Blue circle is the literal translation of the Latin term arcus senilis, which refers to a specific ocular expression that is connected with high levels of cholesterol in the blood. A ring that is yellowish-white in color can be seen around the cornea, which is the transparent front section of the eye. This phenomena is characterized by the existence of this ring. In spite of the fact that it is a rather typical occurrence, particularly among the elderly, it is necessary to have a solid awareness of its ramifications and the possible connections it may have to health concerns. A ring, which is frequently described as yellowish-white or grayish, is the outward manifestation of arcus senilis. Its occurrence is also characterized by its physical characteristics. The outermost part of the cornea is surrounded by this ring, which is often made apparent close to the iris. Individuals who are getting older are the ones who are most likely to exhibit its existence, and it is common for it to grow more noticeable as one gets older. It is generally accepted that arcus senilis is a harmless disorder but is connected with aging. Familial hypercholesterolemia is another condition that is associated with age-related occurrence. It is possible that the development of this characteristic ring is caused by changes in the eye that occur as people get older. These changes include an increase in the permeability of blood vessels. On the other hand, a significant component emerges when this occurrence is detected in individuals who are between the ages of 40 and 45. Arcus senilis has the potential to serve as a possible indicator of familial hypercholesterolemia in younger persons. The condition known as familial hypercholesterolemia is a genetic condition that is characterized by abnormally high amounts of cholesterol in the blood. The emergence of arcus senilis in younger persons can prompt a closer investigation of their cholesterol levels and overall cardiovascular health. This is despite the fact that arcus senilis alone may not constitute a significant concern to the majority of people. Familial hypercholesterolemia is a disorder that is passed down through families and is characterized by blood cholesterol levels that are extremely increased. Atherosclerosis is a disorder in which cholesterol-containing plaques build in the arteries, which can potentially lead to difficulties connected to the heart. Individuals who have this genetic propensity have a higher risk of developing atherosclerosis, a visual signal that may serve as a visual cue for healthcare practitioners to examine the likelihood of familial hypercholesterolemia is the presence of arcus senilis in younger individuals, particularly those who have a history of high cholesterol in their family. In order to confirm the diagnosis and advise appropriate actions for managing cholesterol levels and mitigating cardiovascular risks, genetic testing and a thorough lipid profile might be of great assistance. Although arcus senilis is typically thought to be harmless and does not have any effect on vision, the clinical significance of this illness resides in the fact that it may be associated with underlying health issues. In the setting of familial hypercholesterolemia, the identification of arcus senilis can lead to the implementation of preventative measures and early intervention, hence lowering the likelihood of cardiovascular events occurring in later life. The arcus senilis is frequently taken into consideration by medical professionals as a component of a more comprehensive evaluation of the cardiovascular risk factors of an individual. When taken into consideration with other signs, symptoms, or the medical history of the patient's family, the existence of arcus senilis leads to a more comprehensive knowledge of the patient's current state of health. 6 subtle signs. These include chest pain, angina, high blood pressure, diabetes, and heart attack. The ability to differentiate between excessive cholesterol in the blood and cholesterol in plaques is of the utmost importance. The need for grasping the nuances to prevent receiving incorrect information is emphasized in this section. When it comes to medications and cholesterol, the dangers are revealed. There is an investigation into the connection between cholesterol and medication, with the prescription drug industry being highlighted as the third greatest cause of death. Within this section, the importance of addressing the underlying causes rather than merely masking symptoms is emphasized. The standard approach to cholesterol treatment is called into question, and a more comprehensive knowledge of the body's responses is encouraged as a result. Dispelling common misconceptions. It is of the utmost importance to differentiate between high cholesterol levels in the blood and cholesterol levels within plaques. The section highlights the fact that high cholesterol does not in and of itself cause any symptoms and throws light on the widespread assumption that plaques are something that automatically results from high cholesterol. For carrying out an effective risk assessment, it is essential to have a sophisticated grasp of this distinction. Among the most important indicators are LDL size, insulin, and metabolic health. It is vital to measure the size of LDL particles, insulin levels, glucose levels, and triglyceride levels in order to appropriately determine the risk of plaques. This section emphasizes the significance of concentrating on metabolic health markers rather than relying primarily on cholesterol readings as the primary method of assessment. The report advocates for a more all-encompassing method of assessing the health of the cardiovascular system. Poor metabolic health and determining the connections. While this part examines symptoms that are typically linked with high cholesterol, such as joint pain and poor circulation, it also draws attention to the fact that metabolic health is not in good shape. It has been determined that the underlying cause of these symptoms is not cholesterol, but rather inflammation brought on by metabolic illnesses like diabetes. Having a more comprehensive perspective is possible when one has a better understanding of the relationship between cholesterol and metabolic health. Indeed, the true culprits are the size of LDL and inflammation. The purpose of this part is to emphasize the significance of LDL size and inflammation as important indicators of cardiovascular health by delving deeper into the significance of these factors. It is possible that a more precise evaluation of the risk of plaques could result from a better understanding of these elements. More specifically, it highlights the importance of looking beyond total cholesterol levels and taking into consideration the inflammatory components that are connected with high cholesterol. The blood workhorse. In order to demonstrate a dedication to providing individuals with the knowledge they need to make informed decisions about their health, the winners of a raffle for a full consultation and blood panel are revealed. Within this section, viewers are encouraged to take an active role in gaining an understanding of their bodies and to make decisions based on that knowledge. The need of being aware of the symptoms of excessive cholesterol is emphasized once more in the final section of the study guide. It is possible for individuals to take responsibility for their own health and wellness if they have the ability to dispel misunderstandings, concentrate on metabolic health markers, and adopt an all-encompassing strategy. Because they are equipped with knowledge, they are able to make well-informed decisions for a better life, including the ability to recognize the early warning signs of high cholesterol and effectively address them. The management of high cholesterol for the purpose of maintaining long-term cardiovascular health requires a number of critical components, including regular health checkups, alterations to one's lifestyle, and close collaboration with medical professionals. What do you think of our video? Let me know in the comment section below. If you enjoyed this video and want to hear from me again, be sure to hit that subscribe button before you go. Thanks for watching.